Hello everyone, there will be a continuation of discussion of recall question from the NEET PG 2025. The question is, a 58-year-old male patient with type 2 diabetes mellitus and hypertension presenting with worsening of dyspnea and fatigue, that is breathlessness and easy fatigability. They suggested 2D echo, and this 2D echocardiography reveals left ventricular ejection fraction of 35%. Okay, which is the most appropriate drug we have to select for this case? Option number 1 is pioglitazone, second is empagliflozin, and third one saxagliptin, and option number 4 is glibenclamide. All are anti-diabetic drugs, and recently in the from the Harrison Textbook of Medicine 21st edition addresses the use of SGLT2 inhibitors in the treatment of heart failure. Okay, so first one, pioglitazone, it is a glitazones, pioglitazone, rosiglitazone, these are contraindicated in the treatment of heart failure. Okay, so empagliflozin, that is option number 2, it is comes under SGLT2 inhibitors, that is sodium glucose cotransporters 2 inhibitors. Okay, so they are part of addresses the part of guideline directed medical therapy of heart failure. So there is a new class of anti-diabetic drug showed significant reduction in mortality and morbidity in patients with heart failure with reduced ejection fraction and heart failure with preserved ejection fraction. Okay, the drug mainly dapagliflozin and empagliflozin comes under SGLT2 inhibitors are approved for the treatment of heart failure, that is called guideline directed medical therapy of heart failure. Okay, so what is the mechanism of action? That is a reduction of preload by decreasing the reabsorption of sodium in the proximal convoluted tubule and promoting natriuresis. Okay, they are helpful by increasing the reabsorption of sodium in the proximal convoluted tubule and promoting natriuresis and reduction of afterload. Okay, and another mechanism is these drugs reduces the concentration of cytoplasmic concentration of calcium and sodium and increases the concentration of mitochondrial concentration of calcium by inhibiting sodium hydrogen exchanger in the myocardium. So these are the probable mechanism of SGLT2 inhibitors in the treatment of heart failure with reduced ejection fraction and heart failure with preserved ejection fraction. These are indicated in diabetic patients with high risk of heart failure, okay, irrespective of the status of diabetes. Okay, so here the option 2, that is empagliflozin, is the appropriate drug in this case. And most common adverse effect of these drugs are genital infection because of excessive excretion of glucose in the urine. So the answer is empagliflozin, that is SGLT2 inhibitors. Thank you.